Okay, so here's my setup for our surgery in a little bit. No, the toaster is not being used. Yes, this is my kitchen island. It's the only space I have that is flat and it's got a good light source and easy for me to use. So anyway, I've got antiseptic wipes, betadine, scalpel, scissors, vet wrap, hydrogen peroxide, syringe, gauze pad, and then I set up a box with a bunch of hospital pads in it. And what I'm going to do is lay the rabbit in here, belly up. I'm going to wrap her in a blanket or a sheet and cut a space where the bulge is. And then put her in here. Since it's just me, I don't have anybody to help me. So I'm going to be doing this by myself. Okay. I've got my camera recording. Now I'm going to get the bunny set up. Come here, bunny, bunny. I got Chloe. Oh. Yes, Mama Bunny. Wrap you up like a taco. See how well this works. I mean, that's pretty good. Now we just gotta find your stomach. It's in here somewhere. Somewhere in here is a stomach. There it is. Okay, you comfy there? Got room for your head? Okay. Need to get up more on your chest area. Where's the lump? There it is. Okay, and I need my glasses. So, yeah, it's a good bunny. Okay, so I probably should shave that a little, but I'm not even going to bother with that. I'm going to use some paper towels, wash it off a little. Hey, you. Yes, I know, it's not a fun thing to be doing, but we gotta get this done. Trying to get some of the surface dirt off of it. Make sure you can still see in the camera. Yep, pull it down this way a little. I don't have to reach as far. Okay, now the antiseptic wipes. Oops. And then I'm going to put some gloves on. Just because I happen to have some handy. Normally I wouldn't bother, because, sorry, it's just a meat rabbit. Alright. You ready for this, bunny? It's not going to be fun, but you should feel better when we're done. So here's the scalpel that I bought. Let's see how this works. Don't freak out, okay? I'm just pressing very lightly. I'd rather press too light than too hard. There's getting somewhere. I'm just seeing blood. Yeah, bunny. Forgot to grab towels in case it starts exploding everywhere. blood up a little. You're being a very good patient, my bunny. Okay, there we go. That is definitely an abscess. Here's some of the stuff coming out. Ugh. Alright, I'm gonna get towels ready to get this off of her. See? Doesn't have a smell. See, it's all goopy. So, just gonna keep milking it out. Yuck. You're being a very good bunny. Yeah, I probably should have shaved around there, so we'll know that for next time. Actually, not as much as I thought there would be. Hang on, buddy. I'm gonna use Kleenex. I think you're gonna be a little easier to get that stuff picked up than paper towels, so. You're being a very good bunny. Yes, you are. See how much more we got in there. There's a lot in there. Go, Chloe. Yeah, I got a cat supervising. That's what I need, feline help. Yeah, get all that crap out of there. You'll feel so much better. You will. What's that? There's a big dark thing in there. I don't know what that is. It's on the edge of my thumb. I don't know if you can see it or not. Here it's on the Kleenex. Don't know what it is. Shut up, dogs. I'm a little busy here. I expected a lot more struggling from the rabbit. To say I'm quite pleased with how well she's behaving. This can't exactly be comfortable. Maybe it's a sense of relief to have the pressure off. More goop. Great, now I got two cats supervising. Goal is to try and get as much of this stuff out as possible without causing her too much discomfort, because anything that's left in there just creates more, ran out of paper things, it's just going to create more goop in there. Close to the end. Trying to get underneath it and milk it too, because it was way out here. The swelling was all the way out here, so I want to make sure I get like under it, get all this stuff out. There's some thick stuff. Oop, let's Kleenex over on this side. Gotta have a strong stomach to do this kind of stuff. Can't get grossed out easily. I had a 16-year-old corgi mix who had a sebaceous cyst on her back, and I didn't want to put her through, oh, there's something solid there. I didn't want to put her through surgery at 16, so once just every week or so, maybe twice a week, I'd have to open it up and milk it. So I kind of got used to this. Something that seems to be attached in there somewhere. I don't want to pull too hard. I know, buddy. So I'm not quite sure. I don't know if you can see it. But there's this like white lump here. And I don't know if that's part of her. Or just a big piece of pus that doesn't want to come out. This might not be good, me pulling that. It could be, I think that might be her milk duct. Let's see what it's connected to. No, I think that was just more goop. I don't know. It's out now, so either she needs it or she doesn't. Chloe, cut it out. Oh, there's another piece of it. It's hard to tell. Yeah, you're being a good rabbit. I don't think you have much of a choice. Alright, well, whatever the rest of that stuff is, I'm going to leave it in there. So I'm going to poke it back down in there. So I think I've gotten all the pus out that I'm going to be able to get out. Oh, no, there's some more. How's it going, Mama Bunny? Oh, we got a lot more. You're okay. Stay there. Bonsai, making noise, scaring the bunny, so please stop. How does that look, huh? Just a bit more in there. Wow, there's a lot. Taken out so far. Alright. Just trying to keep the surrounding area somewhat clean. Where'd that antiseptic wipe go to? Hold on, buddy. Might sting a little. Oh, alright. See if there's anything else. Need to work out of that. We're at the end. Oops, ran out of Kleenex again. Okay. So, I don't feel comfortable flushing this with hydrogen peroxide because I think A, it would just hurt her too much. So I think instead we're going to go the honey route and just pack some honey in there. So I gotta open my syringe. Hang on, Mom. And then I will give her a shot of the Pen G. So the honey that I use is locally harvested honey from a lady who lives about a mile from me. I don't know. Put in as much as I think. I'm just winging it here. I don't know what the honey protocol is. So I'm just going to open up the wound a little. Push some honey in there. She's going to be staying inside, so I don't have to worry about flies or anything. I don't know, that was probably about 1 to 1.5 cc's. I'll probably sweep out some of it, or I don't know what the word is I'm looking for. I'm going to clean it out a little. Just kind of push out some of it. There we go. That's the word I wanted. Oh, you're going to be a mess. What I'll do is I'll just push out the, hang on, buddy, can you move your arm up just a second? Oh, don't move, don't panic. I'm just gonna kind of push, and whatever excess comes out, I'll clean off. You're messy now. Okay, so she's got honey in there, she's got that in there. Now I gotta put some kind of bandage on it. Let me get rid of all this yucky stuff. Yucky stuff. I'm going to try cleaning some of that excess honey off the bottom of the wound. Just using a paper towel, water on it. It works. And just kind of wipe off the top of the wound a little. Just a little. Sure that it's not very comfortable. Wish I had butterfly strips or something to close it, but I don't want to put her through sewing. I had fishing line and needles, which is what I would use to sew her up, but I don't want to put her through that. Alright, there's one little thing that needs to be pushed back down in there, so I'm actually going to use the, this is the needle that came with the syringe, but it's the cap of the needle, so it's not even like I'm pushing an actual needle into her stomach. A piece of something sticking out, and I don't know if it's... I'm going to get that in there. There. Okay, so then we put a little, no, I'm not going to put betadine on because I've got the honey on there. So now I have to cut up a pad, or yeah, gauze pad to fit over it. Chloe, Bunny doesn't want you right now. I'll do a little vet wrap. Chloe, no, that wasn't nice. Dumb cat. Poor rabbit's like, yeah, I'm getting cut open without anesthetic, and then she lets the cat whack me on the head. Okay, so that should work. Kind of there. Okay, now I just got to get her out of this contraption so I can vet wrap her. Clean it up a little as I go. That's garbage. I don't even know where it came from. How you doing, Mama Bunny? How are we doing, huh? How's the nose? Well, you know, as long as I got you here, should I clip your nails? Yeah, your nails don't look all that bad. They're not really that long. Yeah, we're going to leave you for this. Okay, let me unwind you now, if I can figure this out. Hold on, Bunny. Don't go anywhere. I'm just going to pull you down like that. I don't want you to lose the pad. Because you still got to get vet wrap on you. I'm going to put her down on the floor and then pick her out of the box and bring her back up onto the counter so I can vet wrap it. Okay. Oh, don't. Jeez. Okay, maybe your nails do need to be cut. And we lost the gauze pad, which landed, of course, clean side down on the floor. So I'm going to have to get another gauze pad. Just hold still. You know what? You're going to feel better after this. No. Stay here. Alright, get my vet wrap ready. Where are you? Blue! It matches your eyes. Not really. I love vet wrap. And I love that you can buy it at the store. Okay, so let's see your stomach again. Which is now kind of... Hey, stop with the clawing. Where is it? I believe that's the out. Hey. I'm holding the gauze pad in place. This is going to be fun. It's like right at the middle of her fat area, so trying to get the vet wrap to stick and not just slide right up her shoulders is probably going to be impossible. But we'll find out. Okay, hold still. Yeah, I know, you're going to love this. Not really. Let me just get it tacked so I don't have to keep trying to hold it in place. Ooh. Swing around backwards. I think we're just going to wrap your whole stomach. Yeah, that works. You're in air conditioning today. Of course, today's like the hottest day so far. It's 90. We're going to be 88 or something. Tomorrow's supposed to be 90 something. So you get to enjoy air conditioning. Yay! That kind of... that. This. I have to teach you to stand up like the dogs do when I'm wrapping them up. Slide back a little so I can get this under you. Alright. That is going to be good enough. Ah, here's the scissors. Chloe, get your nose out of her butt. Jeez, it's very inappropriate. Come on, scissors. You can do it. Oh, thank you. Okay. So I'm just going to kind of tack this stuff in place. Make sure it's going to stay where it's put. Did I get the whole thing covered? I hope. Let's get this. Okay. How you doing, huh? Get off your eyes a little. Look how skinny you are now. Okay, now I gotta go get the recipe for how much of the stuff you're supposed to get. Now, is that dirt? I think that's just dirt because your ears look good otherwise. Ow, you really gouged me, you know. Let's see. Yeah, I don't see anything down in there. Oh, wait, a little bit. Yeah. Okay, so that's Operation 101. Like I said, I'm going to treat her with the Pen G, that Procaine, I think it's called, that I have in the fridge. Keep her inside for the week that I'm treating her with the stuff. Bring her babies in so she can nurse them, which means I'll have to take this thing off to let her nurse twice a day. And see how she does. Right, Mom? Yeah, I know. That was no fun. Okay, stay there. Don't go flying off the counter.